I'm Karina Davidson. I'm pleased to be here. I'm a clinical psychologist by background, and I'm the Senior Vice President for Research at Northwell, as well as the Dean of Academic Affairs for Feinstein Institutes of Medical Research. And lastly, I'm the Barbara and Donald Zucker Professor of Health Outcomes at the Zucker School of Medicine. It's a fascinating question about why we excluded women for so long from the impactful research that was done that decided what treatments everyone should get. There were a lot of causes, historical, ethical. There was some concern that exposing women to experimental treatments might harm them or their fetus, and so it was easier just to leave them out. Since then, we've had a lot of improvements in the transparency of the benefits and the risks for people involved in research. And much more importantly, we've come to understand that if we don't have women in the research that determines what kind of treatment is best for them, we don't know what's best for them. So we're really working hard, everyone, to ensure that women are represented well in all of the research we do, so that we know what works for them. We know that women are not just small versions of men. And we know that how they metabolize drugs, what kinds of risks make them have a worse cardiovascular outcome differs than it does for men. And so by including women in the research that understands what helps them protect their heart health and what works best for them, we get a precise answer that we then can help every single woman, daughter, granddaughter going forward with. So I think you've asked a very important question. I think for women of color in particular, they were almost doubly excluded. We had poor representation of women historically in research, and we had extremely poor representation of people who came from diverse backgrounds. And so sometimes when we look at some of the historical research studies that are the foundations of our clinical guidelines, we see that there was 1 or 2 out of 100,000 research participants included who would qualify as women of color. And just as women need to be represented in research, women of color in particular need to be engaged with and become partners in research, so we understand what works best for them and how to help them with their heart health. I'd love to. So I've been a very proud leader of a really great set of researchers, staff, students, trainees who are really dedicated to improving patient health. I've got medical students who work to figure out how they can help patients take medications better to improve their heart health. I have people who think about what are the 2050 way that we'll be delivering behavioral counseling and other remote interventions into people's homes so that we can meet patients where they are and provide them with the best evidence-based care possible. Really, when you reflect on the changes that have happened in the field of research, it's almost shocking. We went from small studies of 15 or 20, frankly, white men, and assuming that that research finding applied to everyone, to understanding that real-world data from real-world participants who were engaged in the research, in helping form the question and the design, is what we need in order to help continuously improve our healthcare. I think empirically, when you look at the women who are leaders in research and science and institutes, we've had a lot of committees, a lot of awareness, a lot of education. but the data continues to be sobering. The number of women deans, the number of heads of basic science institutes continues to be fairly small number who are women leaders. We have a number of people and institutions across the country saying that what we have tried thus far is not sufficient. And so I'm hopeful for the future. We will see more risky, more high reward interventions that start to ensure that we have equity at the very top of the science field. Because when you have a woman leader for research that voice those concerns, those issues that women have to ensure that they have the best care, that they have the best heart health, start to be ingrained in the way that the research is done. The potential of our future generations to answer the questions that we still have unanswered is enormous. And we leave half the human potential behind if we don't include women in the sciences, technology, engineering, and medicine. And so let's bring them along. They've got bright ideas, and we need to take those to the testing grounds and then out to healthcare. Provocative question to ask. I think we all know that the climate is changing, the toxins that we're exposed to, or the pollutants that are around are going to have, frankly, a drastic effect on women's development, including their hearts and brains. That will be true of all humankind. We need to be working collaboratively, aggressively, and in an accelerating fashion to ensure that all of the protections that we can offer are available so that preserved cognitive function and preserved cardiovascular function is available to each and every woman in the country. We're always looking for volunteers to help us address the questions that we have. There are many resources now available, particularly on the web. And so if someone has a medical condition or an area that they're interested in, they can often look to American Heart Association, their local hospital, Northwell Health, and type in volunteer research and then the condition that they're interested in, and things will pop up. I think the takeaway for anyone listening to this is that women must have a voice and a seat at research, at healthcare, at science and discovery, at engineering and medicine, if we're going to solve the problems and create a better future for the next generation of women. And so I hope, listening to this, someone will pick up the phone, talk to a friend, volunteer for something. Everyone becoming more active in the science movement and the healthcare movement will ensure that every woman gets the healthcare and the heart health that she deserves.